Welcome to Spotlight. With the Texas legislative session in full swing, TPPF likes to do its part in keeping other liberty minded individuals and the public informed on how to keep Texas moving in the right direction. I'm Nicholas Armstrong, policy analyst for TPPF's Center on Health and Families, and today I'm excited to introduce a fellow freedom fighter. With me in the studio today is Jared Walker, the founder of $4. Jared, welcome to Spotlight.
Thanks for having me.
So, to jump right in, today we're going to dive into a topic that, according to recent polling, 62% of Texas patients are unaware of, and that is charity care. To start us off, Jared, give our audience an idea of what charity care is and why it is important.
Yeah, so charity care is a federal law, requires nonprofit hospitals, which is most in America, to have community benefit. So within that falls charity care. If you are within a certain income range, hospitals are actually legally required to write off or reduce your hospital bills if you meet that income criteria. So the unfortunate thing is that hospitals don't do a great job of telling people about these policies, which means we have millions and millions of Americans paying medical bills on payment plans, declaring bankruptcy for bills that they don't have to pay.
Let's back out for a second. How did you get involved with the charity care conversation? Why and how did you found $4?
Yeah, so I started $4 originally as a crowdfunding platform. So I watched my own family go through a medical crisis, realized when you have a medical emergency, a lot of times you have a financial emergency, and I wanted to help people through that process. So I started helping people raise money, very grassroots, coffee shops, breweries, music venues, to help people pay medical bills. I did that for years. And then I found out about charity care. And like so many, I had no idea what it was. But I had been paying medical bills for low-income families that all would have been eligible for these programs. So I was really frustrated and wanted to kind of dive into these programs and see what they were all about. And honestly, I kind of felt like how a lot of patients feel. It's too good to be true. Is this actually going to work? And it did. I started helping patients apply, looking through applications and policies. And in a few months, I got over $1 million of medical debt to be cleared for people. And that is kind of when I knew, okay, this is like the best kept secret, like how do I get this out there? So that is how I got started. And then in 2021, we posted a TikTok video that went viral, and here we are today.
So you mentioned that this was kind of a well-kept or a hidden or a secret. Why do you think that is? Why do you feel that a lot of patients don't realize or understand, or that this isn't kind of broadcasted out to different patients, particularly low income or those who are uninsured?
Yeah, hospitals just don't do a great job of telling people about these programs. The requirements for this law are pretty low. So, have a poster in the ER, put some fine print on the back of the bill. And we know that doesn't work. So I think that is, problem number one is it's not known. At $4, we always say we want to make charity care known, easy, and fair. And right now it's just not known. Hospitals don't tell people about it. And why is that? I think we could all have some ideas, but I think what it comes down to is what we have found is it seems like hospitals are just more willing to try and bill the patients that they think might not be able to pay than try to screen them for charity care.
So let's bring the conversation to Texas. We've kind of gone on a national level of what it is, what charity care is. Talk us through. Are there any patient stories that stand out in Texas that you are aware of, or what does your work look like in Texas compared to the rest of the country?
So I started doing this primarily in the Pacific Northwest, and when I started expanding it, and I had a patient reach out to me from Austin, Texas, and said, "Hey, I got a $75,000 medical bill. He got hit walking home by a car,
Mm.
and I was trying to help him through the process, and it took me 7 months to get this
Wow.
charity care application approved, which it shouldn't take that
Yeah.
long. So I realized that things are a little bit different in Texas. I think that Texas hospitals, so one, Dollar Four is a national organization. We help patients all over the country. We get the most requests for help, the most applications submitted, the most medical debt relieved from the state of Texas, and I don't even think it's close. So it's definitely an issue here in Texas, and hospitals. I think, I think that there's a handful of bad actors that just are. It is difficult by design to get charity care.
Mm. So, kind of walk us through that process. So, let's say that I have a medical emergency and I either don't have insurance, I'm underinsured, or I fall in that particular income bracket. What does a charity care application look like to me if I'm that patient looking at it, and how does Dollar Four help uh, patients, particularly in Texas or more nationally, wade through that process of trying to figure out how they can go for this financial assistance that seems like Section 501R requires them to do.
Yeah. So if you are a patient just at the hospital, you call the hospital and say, "Hey, how do I apply for charity care?" Assuming you know what it is. Uh, then they're most likely going to send you a packet in the mail, in 7 to 10 business days. You would complete that and you would either mail or fax it back to the hospital. That would be what the
We're
process
still using faxes in 2025.
apparently, because we spend a lot of money sending faxes. So it's so that is the typical way at most hospitals throughout Texas, but throughout the country, unfortunately. So what Dollar Four has done is we've created a database of every hospital in the country, over 8,000 hospitals. We've captured all of their financial assistance policy data, so their income threshold, all the things that would make you eligible. And then a patient can go to our website, put in their household size, their income, what hospital, and it will tell them if they're eligible. Once they are found to be eligible, we've created digital applications for every hospital so they can fill it out on their phone. And then at the end, click a button and it sends it to the hospital, however the hospital would like to receive it. So that's what we've done to try to make this process easier. But Dollar Four, can't be the nation's charity care customer service line, right? Like that's not what we want to do. We want to um, shift that burden from the patient to the hospital because right
Mm.
now all the burden falls on the patient to find out about these programs, to apply, to fight and advocate for themselves. And that should be shifted to the hospital. The hospital should be responsible to vet people for these programs, help them apply, and make the process a little easier.
Mm. So you saying that you have been able to automate a lot of this with all of the hospitals. Have you found any hospitals that are willing or that have automated via by state law or themselves that have automated this? Have you seen any of them kind of come up with that electronic usage of it or an easier usage for patients to access this particular program?
We see a couple hospitals that have created digital applications. A lot of hospitals are trying to get better at their presumptive eligibility, pre-screening. Uh, but I think that when you go to traditional financial assistance, if you have to apply, it's pretty rare that we see, a slick user interface kind of stuff. But if you need to get on a payment plan, that's real easy. So it's definitely not a priority for the hospitals
Mm.
to make this process seamless for patients, it seems.
Mm. So I want to zoom back out again. You mentioned the Pacific Northwest, and 'cause that's where you're originally from, and where Dollar Four was started. There was a particular story from the Pacific Northwest about one particular hospital in Washington State that had sent over 100,000 charity care eligible patients to debt collections, and they had to. There's a whole lawsuit with the Attorney General Bobby Ferguson in Washington State, and that hospital had to end up refunding over 157 million dollars in two patients.
Mhm.
Um, was what became of that? What did some of the other states in the Pacific Northwest, Washington State, Oregon, what did they learn from that? And then was there any new laws that came out of that sort of lawsuit?
Yeah, so Providence, that whole case was interesting. I think one thing to take from that is people were looking at that going, "Oh my goodness, like this is a one-off kind of thing." I don't think that that's the case. I think that hospitals trying to squeeze as much as they can out of poor patients that are unable to pay, uh, instead of offering charity care, is something that we see at a lot of hospitals. So I think it's Providence might have been particularly bad, or they just got caught. So it's from that one, Providence has been on their best behavior, and other hospitals in Washington. In Oregon, we helped pass a law in Oregon that was essentially saying, hey, you can't send these patients to collections without first screening them for charity care. So again, trying to get pre-screening, because patients need to be screened for these programs. They need to be told about these programs. They need to be screened for them. So that was one thing, which makes sense, right? If you're eligible for a program that can reduce your medical bill, you shouldn't be sent to collections or sued for that bill. So that's one thing, a good thing that came out of that. And I think that Washington has tried to tighten up a few things with their charity care laws as well.
Yeah, and we've seen in some other states, like for example, Indiana has filed a bill for taking away the property tax exemption for nonprofit hospitals that are overcharging what Medicaid or Medicare charges. And we've seen instances in Pennsylvania where Pennsylvania has taken away the state property tax exemption. So other states are looking at this issue, and they're finding that it's a big issue with their nonprofit hospitals as well. Montana also did a state audit. So with all of the topics going on in the 89th legislative session, what would you say? Why should the Texas legislature budget time to look at this particular issue with things like AI regulation, school choices on the board as well? Why should the Texas legislature budget time specifically to look at this issue?
Yeah, I think that this is the lowest hanging fruit to help people right now. Medical debt is still the number one cause of bankruptcy in America. We have, 1 out of 3 patients are just neglecting care because they can't afford it, which makes it more expensive for everybody. This is something that we already have a law in place. And the fact that we have low and middle income patients that are declaring bankruptcy or going on payment plans for bills that they don't have to pay, the eliminating the medical bill is the tip of the iceberg. Underneath, you have people able to finish their education, able to put food on the table, pay their rent, electricity. If you want to help people right now, charity care is the lowest hanging fruit. I don't even think it's close. So that's what I would say of why it's a big deal. I mean, $4 has eliminated over $75 million in medical debt for people all across the country, simply by enforcing a law that already exists. Now, imagine if we got states to get on board with holding hospitals accountable to the laws that they're supposed to be following in order to keep their tax exempt status. They should be paying their fair share, and also not neglecting their patients' financial situation.
And to follow up, do you think it would be beneficial for maybe taking a page out of Oregon's book, or have you seen any success with the pre-screening of those patients, basically assuming that they are eligible until it's proven otherwise? Have you seen that taken a positive effect in Oregon or in other states that have looked at that?
Yeah, a lot of the positive we see is at particular hospitals, because I don't think that a state has implemented this perfectly yet. But yeah, I think getting better at the pre-screen. It's kind of like 1, 2, and 3. 1 is pre-screening. Hey, there are things that if somebody is on another assistance program, that the income threshold is lower than charity care, they're obviously eligible for charity care. So don't give them the whole, run around with the application. There's things that you can ask patients to see if they're eligible for charity care without requiring so many documentation and all of that. After the pre-screening, you have traditional financial assistance. Fill out the application, what we help patients do right now. And then after that, it's like, don't sue patients, don't garnish their wages, the protections around that. So that's kind of what we want to see. Have I seen it perfectly implemented yet? No.
Well, Jared, thank you so much for joining Spotlight, and we hope to have you back again soon.
Thanks for having me.